Hey y'all, it's Rick and Annie. We're going to be going through an upper extremity corrective exercise series, and we're probably just going to do it on one side to keep it short. So just to give you a heads up on what we're going to do. Annie, we've decided, has upper extremity postural distortion. So in an overhead squat, her arms fall forward. So we're going to do a release technique. So we're going to inhibit her lats and her pecs. We're then going to have her lengthen it. Then we're going to do an activation technique, and then we're going to do an integrated exercise to help strengthen and bring everything together. So, Annie, you ready?
Yes.
All right, come on down. Let's get that foam roller, and what we're going to do here is I'm going to have Annie go right basically into her armpit, but on the back side of it. So Annie's going to be rolling, not quite even her lats yet, but she's getting in that area with the tight muscles in the posterior side of the shoulder. And then as she rolls farther up, so the roller's coming down on her, there's a place called the scapula, right? So, or the shoulder blade. That inferior angle, that very last portion, the lats connect there, and you'll see when she hits it, because she's going to make a face. All right, so when Annie feels that little portion right there, it gets to be pretty tight, and that's where a lats connection. It's a nice place to release from. So Annie, you got that spot? Now remember, we're going to do a couple of releases. We'll hold minimum of 30 seconds to let that autogenic inhibition take place, let the muscle mechanoreceptors relax themselves. And then we're going to go right into the next exercise. So Annie, let's go right into the next release. So what she's going to do, I'm going to have her roll back down a little bit. And just because I want to make sure that she's not rolling anything but muscle here, slowly now roll forward so it's right here, just at the bend of the armpit. And she's going to do a release right there of the pec major, and the pec minor also happens to be in that area. Now, this is a heads up for you. If your client, and you need to ask, don't just assume that they don't feel something. Ask your client, do you feel any numbness or tingling? If they do, that's called not good. So make sure that they don't have any tingling, any numbness, because they're on a nerve or blood supply or both. So hop off of that spot, find another spot, make sure it's only muscle. Annie, you get a nice little release there? Fantastic. So those are our two inhibitory techniques. I'm going to have you flip right over so you're face down into a child's pose. And the child's pose is what we're going to use to lengthen those lats out, and it'll actually lengthen the pecs out as well. Now there's multiple ways to do it, but this is the way we're going to do it. And what I've done, I have her go into this position because she stretches the lats by having a posterior tilt here. She's reaching the arm forward, and I'm going to help her just a little bit. I'm going to brace her a little bit here, and then I'm just going to roll that forward, but I'm locking her hand on there so her arm reaches forward. That way she's getting some scapular elevation, getting additional stretch in the lat here on this side. Do you feel that stretch in there, Annie? So if I wanted to get a little more of a stretch, then I could actually have her shift her backside that way. So she create like a crescent moon here, so she's lengthening the lat this direction. All right, so let's go ahead and have you come up. Let's go ahead and start some activation exercises. So come on up this way. And the activation exercise I'm going to have you do is I'll actually have you squat down a little bit, and you're going to go into your YTAs, or this is what NASM calls their combo number 1, right? So she's going to go up into a Y position, so Y. And this is a nice activation for these lower traps right here. Go ahead into your T position. Nice T position. Again, retraction, but now we have some horizontal abduction, so we're strengthening posterior delt. And then come back into your YTA position. And she's got a nice little external rotation here. She's squeezing her traps. She's retracting her shoulder blades. And you may even get folks that are really firing up in their triceps. And we're not going for this tricep activation. So if that's the case, just have them come out a little wider and squeeze back more. Good. Go ahead and do another one. Y position. This exercise is called scaption. So she's doing a scaption here. Go ahead into your T. This is a reverse fly. And then let's go ahead into your A position. And if you guys are familiar with our work, this is what we do. We call a floor cobra, except we're standing now, so this is a standing bent over cobra. Let's go into our combo number 2, Annie. So what she's going to do now is she's going to go into a row. So this is a high row, not an upright row, it's a high row. She's getting her posterior delts really active here and doing her retraction. Now she's going to rotate. She's going to do a shoulder press. Now it's really firing up these stabilizers in the scapula. Let's do a lat pull down. Good. Rotate in and dive into the pool. Let's get one more. Go ahead and pull it back. rotate up, overhead press, lat pull down, rotate down, and dive into the pool. Very nice. Stand up, face towards me. Now we're going to go into our integrated exercise. So I'm going to have Annie do a squat to a high row. And again, a high row is this position, not here, because I don't want those lats continually pulling her into this kind of protracted position. So she's going to go up, bring the elbows up high, keep that upper trap area, the posterior delts quite active. And I'm going to give her a pull from this angle. So Annie's going to go ahead and squat. She's going to drive forward, squeeze the glutes, and then, yeah, there you are. Good. I'm going to bring it up a little bit higher. It was almost turning into an upright row. So go ahead, and that's much, much better. And you'll notice there should be a straight line between where her elbows are and the line of this. So if I come down too low, she's going into an upright row, and that's not a great position for the shoulder to be in. So we're just doing high rows. Let's give me a few more. Squeezing those glutes. Hold it up at the top. And 3. Good. Abs, glutes tight. Good. Nice retraction. And one more time. Hold it. Hold it. Relax. Very nice. Cool. Thank you, Annie. And this is a nice little corrective exercise series. You guys go back through and make sure you look at this is the highlighted version of it. So make sure you go back through, you make sure you get both sides if both sides are affected, and then put this stuff to use. All right. Thanks again.